Hi, everybody, and welcome. We are talking about dental health today as part of our Cary Medical Center virtual health fair. And this is also the last day of our health fair. And so we wanted to end it with, a bang. And we're going to talk about something that is really important. And a lot of times people sometimes don't realize just how important it is. And that is our dental health. And so today we have our amazing dentist from Pines Health Services, Dr. David Levasseur. And we are going to ask him a few questions that some of you might have been thinking about. So the first one, I've read several articles recently about mask mouth, and which is a condition that some doctors out of New York have noticed as they've had patients coming in with some dental issues, and they've identified some of these issues with wearing masks all day. So can you tell us a little bit more about this?
Yeah, sure. So mask mouth is essentially just dry mouth from wearing a mask throughout the day and long term. Um, it's not exactly something new, as most dental professionals have been wearing a mask pre-COVID throughout the whole day, as well as many medical professionals. But it's gained some attention in the media because the general public's not used to wearing a mask long term. So by wearing a mask long term, they are experiencing some dry mouth. They're getting some malodor. Some patients are presenting with an increased cavity risk, some periodontal disease, but mostly dry mouth and some malodor from wearing a mask long term.
Okay. All right. So, can you tell us what we can do to kind of avoid this mask mouth?
Yep. So first and most importantly is just good oral hygiene. Um, Seeing your dentist regularly is great. If you're experiencing like a heightened mask mouth or pretty severe dry mouth, some good tips to try at home are like an over-the-counter dry mouth rinse that can be found at most grocery stores, Walmart, most stores in general. You can use a fluoride rinse as well. Brushing, flossing, using or chewing sugar-free gum. That's a great option to help stimulate saliva, which then helps prevent dry mouth.
Okay, great. Yeah, I think it was Patty in your office that advised the gum for me one time. Just to kind of if you're especially if you don't have time to brush and to chew. I think it was Mentos, the pure one, so
Yes.
that make sure it's sugar free and yeah. So that was some great advice that I got from her, and also, really, I guess we want to make sure that people know not to stop wearing their masks too, out of a fear of, something happening with their dental health. But just making sure that maybe you breathe through your nose a little bit more, you're saying, so
Yep,
that we're not
absolutely.
getting that dry mouth.
Yeah, for sure. Yep.
Yeah. Okay. All right. And then, I've also had some people commenting that they're noticing that they have bad breath because now they're able to smell their breath when they have a mask on. And so, what are some things that they might want to be alert of with noticing that they have bad breath?
Yeah. So on top of like oral rinse, chewing gum, just trying to have take some water throughout the day as best as you can to promote that saliva. Um, like sugar-free mints or like a throat lozenge is great. Just again to help. The whole goal is just to promote saliva and keep your breath fresh at the same time.
Okay. All right. Yeah. And then definitely call and make an appointment with you if they have more concerns, huh?
Yeah, for sure.
Yeah.
Absolutely.
Yeah. And then today is Halloween, which is when, this is going to be airing for everybody. And all the kids are going to be out. I know some parents might be keeping their kids home, but they're probably still going to be giving them candy. And other kids are going to be filling up their buckets with candy. And so, what advice do you have for parents and kids on a day like today where there might be some candy overload?
Yeah, so it is, once a year, so it's kids and parents should be allowed to enjoy some candy today. But of course, in moderation. We just want to avoid having grazing on candy throughout the day because that means tons of sugar stuck on kids' teeth. And so having your candy like pair with a mealtime or during a snack is great. That's a great option to enjoy your candy as well as maintaining like good nutrition as well. Of course, on Halloween and every night and morning, you should be brushing and flossing for 2 times a day or twice a day for 2 minutes, but especially as important on Halloween night because we're for sure going to see some kids with extra um, candy intake for sure.
Okay. Yeah. Yeah. Especially those sticky ones like caramels and
Hmm.
stuff. You want to make sure you get
Yeah, for
that off your
sure.
teeth. Yeah. Yeah. And some orthodontists might not approve of those either. So,
Definitely not. No.
yeah. Okay. But we definitely hope people stay safe out there on Halloween today. And when you're done, brush and floss. And do you have any other suggestions for people to help maintain their dental health? No. Did we freeze?
Be great to find one or establish at a dental home sometimes, somewhere in the county.
Okay. I think you just froze there for a second.
Oh, sorry.
It's all right. Yeah, were you just saying that they need to find a good provider? Is that what?
Yeah, just encourage everyone to find a dental home that
Yeah.
meets their needs. It's great.
Okay, great. All right. Well, thank you so much for joining us today. I know that you guys are super busy. And if you all have been to your dentist recently, you know that they are definitely the unsung superheroes of this COVID-19 because you all are decked out head to toe and, masks and gloves and gowns. And so we definitely appreciate all that you're doing because our dental health is important to our overall health. And
Mhm.
so thank you again for joining us.
Yes, you're very welcome.
All right. Thanks.